Right, the last two actual bones of the skull, of the cranium, let me rephrase, is really difficult to see. So on a model like this, right, the sphenoid bone, which is found right here, really hard to see compared to where we see it in the, right, in the multicolored skull, which I'll show you in just a second. So here's a multicolored skull. Now the red is the outline of that sphenoid bone. Here's a temporal. Here's the zygomatic process of the temporal bone. Here's the sphenoid bone. All right, the sphenoid bone forms the posterior wall of your orbit. So as I open this up, you can see all that red helping form that posterior wall of your orbit. Now, the sphenoid bone is going to have a lot of interesting things that we can see on it. Number one, this is what the sphenoid bone looks like when it has been removed away from the skull. What we notice when it's been removed from the skull is that it looks like it's got a saddle-like region right here. This saddle-like region right there is called, right, the saddle-like region is called the sella turcica. The sella turcica contains an indented area right here where your pituitary gland is going to rest. This is called the pituitary fossa, and this is where your pituitary gland is going to sit. Now, what else we notice is that when we look at the sphenoid bone on this side, right, you see that it has a smaller wing on top called the lesser wing, and then it's got a much larger wing region up here. And people consider it kind of looks like a butterfly, right? Some people, when you look at it this way, say it looks kind of like an owl. When you look at it this way, you see the, right, what looks like the ears of the owl. That is your lesser wing. The wings of the owl actually helps form the fossa where part of your brain rests on. So this is that greater wing region right here. All of this is a greater wing. Lesser wing on top, greater wing on the bottom and larger. Now besides that, you see these two regions that are like legs and talons coming down. These are what we call the pterygoid processes. These pterygoid processes is going to allow for muscular attachments to the muscles that will allow you to grind and move your jaw, right? The lateral, so you're going to have the pterygoid processes. And remember, right, if it's closer to the middle, these are your medial pterygoid process. Then these two, this is the lateral, and the other one's the lateral pterygoid process as well. So you have two medials, one on each side, and two lateral pterygoid processes. Remember, the pterygoid has a silent P, so, all right, we'll take a look at it with that silent P setting on there. And again, all right, we're going to talk, there are some holes here that are important. Number one, you see an opening right here. That opening right there actually leads to the orbit. So that region right there, that is called the orbital or optic foramen, right? The optic foramen is sometimes called the optic canal. That optic foramen allows the optic nerve to exit and go into the eyeball. So if you take a look deep right in here, you should see a very narrow, small optic foramen on this angle as well, right? Only for the optic nerve to go through. Now, immediately below that, you see a much larger kind of hole or cut. This is called the supraorbital fissure, right? This allows muscles to exit. This allows, as well, major arteries of the eyeball to penetrate through. This is not where the optic nerve goes, though. The optic nerve only goes through that optic foramen or optic canal. As I move it this way, then you're going to see that over here, right? Sometimes called the hypophyseal fossa, sometimes called the pituitary fossa, right? So this is where the pituitary gland rests. And then you see two small holes here. These holes are called the foramen ovale. They look oval shaped right there, right? So that's pretty easy to see. And then if you look on the anterior side of this model, you see two holes underneath, inferior to the supraorbital foramen. These are your foramen rotundum.